My name is Mary Habig. I am the director for North Central Area Transit. We're a public transit system, a nonprofit, and we service Seneca, Crawford, and Huron County. We provide public transportation to anyone that lives or visiting one of the 3 counties that we provide services in. There is no age or income base to ride our service. Public transit's for everyone. We have special funding that was given to us by the United Way. With those funds, we help people who have low to no or fixed income. We get them to education, we take them to training, we take them to rehab, we take them to probation. We're able to get people to their much needed doctor appointments, including expecting mothers. When you live in rural Ohio, they're limited what doctor care you can receive. These small hospitals do a fantastic job, but sometimes they don't have the specialties that a lot of people need. But we take them to Columbus, Canton, Mansfield, all the urban cities where the specialty care is. So we provide that service for them to get them to their much needed medical appointments. A lot of our clients are on a fixed income or they have no income. A lot of folks starting their life over again and they're in entry levels, so therefore they can't afford a car, insurance, and fuel. We don't ever want a mother to decide, do I have to buy formula, diapers, or transportation? We want to make sure we're not burdening them with that cost. Sometimes they only have to pay $1, sometimes they don't pay anything. It depends on their need and what their income is. We have them fill out a form, we look at their expenses, we look at their income, and then their household. And we use the federal guidelines to see, and with the United Way funds, we're able to draw down federal funds as a matching fund. And when I can get those grant fundings to come in and the United Way funds help me pull down those federal dollars, it's a win-win. You know, we've had a lot of factories that have reached out to us that they have needs and they have openings and they want people to come and fill those openings, but most of the people will tell them they don't have a way to get there. So we're able to close that gap and bridge them over, and they now have an income. Not only does it help the employer, it helps the employee, and it helps the community. I can tell you in 2023, we transported just in the Seneca County area, and that does not include Fostoria. We transported almost 1,000 people, not total trips, that's just individuals. So almost 1,000 people we helped just in the Seneca County area. Well, we had a mother who recently got her life back together. She had made some wrong choices and she lost her children. She is gainfully employed. She's getting her children back. So in the process of getting back, the courts reached out to us and said, hey, these kids need to go to school, but mom works. And she doesn't have access to get them to and from, because she can walk to work, but the children cannot walk to school. So we take those children to and from school every day that they're school. They've not missed any days of school. So that's a success of 3 young boys learning the value of education. They're not at home and they're going to get their education, and mom can work. This job, you know, we don't get rich working here, but the reward is just amazing. You know, when you can help a child get to and from school, a young mom trying to get to and from work, somebody go to mental illness appointments, somebody getting their dialysis, you just feel so good helping the community. The average age of employee here is 65 years old. Most of these people that work here are retired from a different career. And you ask them any day, why do you work at NCAT? Well, I want to give back to the community. They all tell you it's so rewarding when you can help that little lady to the grocery store or even to the beauty shop, when you can help those folks, because it makes them feel good, it makes you feel good. If there was no public transportation in rural Ohio, you would have people not getting their medical appointments, including mental illness. You will have people being truant. They want children not getting to school. You know, we give people freedom to go wherever they want to go. United Way has been supporting, it used to be SCAT, now NCAT, before I was here, and I've been here almost 11 years. So they've always been a partner. Without the United Way funds, our providing services would be limited. We'd have to cut back. We need to thank those who donate funds to the United Way. Without their support, I don't know what happened to their communities. Thank you for supporting United Way.